We are live streaming this. My name is Stephen Wickham, and this is my wife Karen. We're both registered nurses, and we are doing a program that we call Diabetes Reversal Explained. Now, diabetes is the fastest growing chronic disease in the history of the planet. We are doing something differently with our lifestyle right now, which has just made this explode. So, it's something that we need to address. We need to find out what's causing it, and we need to find out what we need to do to cause it to go the other direction. A week and a half ago, Karen and I were down in Florida doing a presentation, and I would guess we probably listed over 100 diseases that we are knowledgeable of that can be reversed by following the principles we're going to teach you in this program. If you don't make the lifestyle changes, we can't help you. You know what? It really happens in the home. So the way that the program works, we'll come in and we'll give you a lecture. Then following the lecture, we're going to demonstrate a form of exercise that's about 9 times more effective than the standard cardio workout. So you're going to get a real bang for your buck if you do this. And the people that do the exercise portion typically are the first people to reverse. I will know by the second or third night who's going to be the first people to reverse. And you probably won't reverse during the course of this program unless you're very aggressive in your lifestyle interventions. It usually takes people 3 to 6 months. Sometimes, if you're further down the road, it may be a year or more.
And I'm going to share a story about a gentleman that did not totally reverse, because not everybody can. It depends on where you are on the journey.
And so, anyway, tonight's lecture is getting started with diabetes reversal. And I like to start at the very beginning. It says, in the beginning, God created the heaven and the earth, and God saw everything that he had made, and behold, it was very good. Can I go back any further than that? I personally don't think so. But it's my personal belief that God did create you and me. And therefore, he knows a lot of what will make us tick or not. So if you will indulge me, I would like to have a prayer for you. You know, lifestyle changes are really difficult. And I think if we call on a higher power, sometimes that higher power will help us make those changes. So let's bow our heads. Heavenly Father, I just pray that you will bless every individual that's come through the door here, because they have health issues, or perhaps they know somebody that has health issues that needs this information. So be with them, each one, and help them to grasp the concepts of what they can do in their own home to reverse diabetes. And we thank you for hearing this prayer in Jesus' name. Amen. The program here is for educational purposes only. We ask that this should not take the place of your doctor's advice. You hire your doctor to get you through the disease process, to help you have the best outcomes. But he doesn't have the time to sit there and tell you the information that you need to know in order to reverse your diabetes, because it takes some time. So lifestyle is the only way that you can reverse. He can help control your blood sugars. He can put you on medications. If you are already on insulin, the people that are on insulin typically will reverse more slowly.
Is there anybody here on insulin? Just so we know. Okay, thank you.
Okay. And
your physician will manage your medications, though. We will work with you. We will educate you. And that's why you have a letter to take to your physicians, so that they can know that you're going through this program, and they can help you to adjust your medicines as you need.
Now tonight At the conclusion of this lecture, you should be able to define insulin resistance, and you should be able to state the primary role of insulin and identify the first steps toward diabetes reversal.
Why did it come up after?
I don't know. There's your before.
Okay, well, you get to see the before and after. This is Norman, not actually a picture of Norman. This was a substitute for him. But when he walked through the door to the first diabetes program, he was very sick. He had had type 2 diabetes for 24 years. He'd been on insulin for a long time. He felt very badly. In fact, he had gotten to the place where he had had complications, had actually had bypass surgery because of heart issues that he was having. He was on 23 medications. He was on 6 insulin shots a day because his sugar was running so high. He weighed almost 300 pounds, and even with the 6 shots of insulin, his blood sugar still ran between 300 and 400. So he came to us, he learned the first night what we're going to teach you, and he went home and he started doing it. And little by little, his physician had put him on a sliding scale insulin, and little by little he was able to cut that insulin down. After a year and a half on the program, he was down to only 7 prescriptions. His blood sugar most of the time was less than 140, which means that he only had 2 to 3 insulin shots a week. He had lost almost 100 pounds. He was feeling so much better. He was out going to his kids' events. He was out hiking around in Grundy County, which is where we lived at the time when we met this gentleman. And he was so excited. And one of the things that he said is that he said, "You've given me back my life." Well, it wasn't us. We just did the education. He's the one that did the work. But he got in there and he started making the changes. He worked closely with his physician. And what his physician did, the sliding scale means that if his sugar was less than 140, he held his, or he reduced
he would decrease
his,
it. He would decrease it by 3 units.
by 3 units. If his blood sugar was above 140, he stayed right where he had been on his insulin dose. But as you can tell, he was reducing his insulin frequently to get down to where he only needed those shots 2 to 3 times a week. It was so exciting to see.
There's a scripture that says, "My people are destroyed for lack of knowledge." And I can't think of a place where that is more true than in the realm of diabetes. And so what is type 2 diabetes? It is a disease of carbohydrate intolerance that is characterized by increased insulin resistance, abnormal blood sugar levels, and is often associated with obesity. So, insulin, we need to go there and discuss that a little bit. It is a hormone that is responsible for regulating your blood sugar, but it is also a growth stimulator. And the problem comes is when those things get out of balance. Now, we talk about insulin resistance. We can't get away from this. I would if I could. But insulin resistance is very similar to drug resistance. You know, somebody goes out and starts taking street drugs, and then they begin developing a tolerance to it. In order to have the same kind of reaction, that same good feeling they had with the first time, they have to take a larger and a larger and a larger dose. In the hospital, I've administered doses of medicine that would kill an average person. But the individual was so insulin resistant or not insulin resistant, but they were so drug resistant that they could take a whopping dose. Well, the same thing happens in your body, inside with your body chemistry, when you go down the road of diabetes. You become more and more resistant to insulin, so it takes larger and larger amounts of insulin just to get your blood sugar under control again. And eventually your pancreas, which produces the insulin, it will get fatigued and it will stop producing as much insulin. Then the doctor tests your C-reactive protein and he says, oh, now you're not producing enough insulin. You know, the insulin level will gradually decrease and decrease, and then the doctor starts adding more insulin to it. Taking a medicine like insulin actually will help keep you diabetic.
And we'll explain that.
We'll explain
another night.
why later on, but it becomes a self-fulfilling prophecy. We have told people for years that this controls your blood sugar. Just take a little more insulin and have your piece of birthday cake. That's all you need to do. And that turns out, as far as diabetes reversal goes, that's bad advice. It may be good advice for controlling your blood sugar, but it's bad advice. And we will get into why that happens. But if we understand insulin resistance, you will intuitively begin to understand what you need to do in order to reverse your diabetes, and it all happens at the cellular level.
Now, the body has 37.2 trillion cells. Don't ask me who counted them, but that's what science tells us. How many? And they each require energy to function. It's just like we have to have, if we're going to wash our car, we have to have water, we have to put some energy into cleaning. Well, within our bodies, we have these cells, and they each have to have energy. And the energy that the body wants is called glucose. Now, in your booklets, especially those that are new, I can't tell you what page. Becky, can you tell us the page? Right there at the bottom, page 2? Okay, you will find the main information. We will give you the highlights of what we're talking about will be in your booklets that you can follow along and make notes. Okay, so on these cells, each of the cells have multiple doors, or like multiple doors. And that is how glucose is delivered into the cell, so it can burn this glucose for the energy that it needs to function. There's front door, back door, side door, garage door, kitty door. There's just doors all over, just like our houses. Well, on the cells, there are lots and lots of these doors, but the doors are all locked. We need a key to open those doors to get the sugar, the glucose, out of the bloodstream into the cell. And what is that key? The key is insulin. Yes, thank you. Insulin is the key that will move that into the cell so that it can be burned. So inside the cell, there's a little furnace. You see our little furnace there, where the glucose is burned. And it gives us the energy that we need for whatever that we want to do. But when we have extra glucose that is put into the cell, it's stored. And it is stored in concentrated form, glycogen, and fat. It's like there's these little containers that are in the cell where these are stored, and we'll talk about this later. So when we have normal metabolism, we eat our meal, the food comes in, and the blood sugar rises. This is normal. It's like little sensors go down to the pancreas, and it tells to release the insulin because there's sugar coming. And so insulin is released. It goes to the cells. It opens the doors where the sugar can be moved into the cell, and out in the bloodstream, the sugar level returns to normal, and inside the cell, the sugar is burnt for energy. So that is normal metabolism that we have. But when we get insulin resistant, the cells are overfed. So when we eat the meal, the message goes down to the pancreas to release the insulin, but it takes more insulin to be released to open whatever doors it can find that are not locked. There are so many of them that are locked. In order for them to move the extra that's in the bloodstream into the cells, we need that extra insulin. But what happens is when all this extra energy, the extra sugar gets stored in the cells, finally the cells say, wait a minute, I don't need insulin bringing me any more sugar. So it takes some of that sugar that it has and it makes gum out of it and it locks the doors. So when insulin comes along to put the key in, the doors are locked and it has to work harder to try to find the doors that are unlocked that it can put it in. But we get in this vicious cycle needing more insulin, and the cells saying, I don't need it, locking more doors with the gum. So this is what we call insulin resistance. Those cells are locked, they are resistant to the insulin coming and putting more sugar in them. So when we have insulin resistance, there are a lot of symptoms. And you may have some, you may have part of them, but a lot of people will have most of these. Upper abdominal obesity, and it may just be a little bit right up here, maybe slender. Steve had an aunt that was very, very slender, but she had a tiny little pooch right here. And so upper abdominal obesity, fatigue, laying on the couch, just can't get up. Migrating aches and pains can be a headache today and an elbow ache tomorrow. Cravings for sugar, inability to lose weight, hormone imbalance, high cholesterol and triglycerides, low thyroid, constant hunger, high blood pressure, polycystic ovarian syndrome, or also polycystic breast disease as well goes with this, and increased fat storage. These are all symptoms of insulin resistance. If you are experiencing a lot of these, you may have the insulin resistance. So insulin resistance is a condition caused by a lifestyle in which energy intake is more than energy spent. So we're taking in more than what we're using up. And that's how we get in this cycle where we have too much and so it gets stored. So where do you start?
Good question, huh? So what we're going to do is we're going to go over the elements that we're going to talk about here, and then we'll zero in and focus on one. SMART goals is the place to start. I used to work as a director of nursing of a hospital, and had Joint Commission inspectors come in one day, and she said, well, what are your departmental goals? And I just, we had talked about these in staff meeting over and over again, you know, and so I just rattled them off on the top of my head, and she said, show them to me. And I said, well, I don't have them written down. She said, you don't have goals. And she just cut me off right there. Didn't matter that they, you know, was reflected in the minutes or whatever else. You know, maybe I should have shown her the minutes. But I was off guard. There are goals, there are a lot of differences in goals. And SMART goals are ones that are very healthy. They've been used successfully in business for more than 50 years. So it's something that we can use regarding our health. You know, good health is actually a decision that a person makes. You make the decision that you're going to be healthy, then that drives choices that you make which yield good health. And so SMART goals is a great way to get there. Now, one of the things Karen was talking about was obesity or weight gain, extra weight gain, energy, insulin resistance is caused by more energy in than energy spent. And that's a simplistic answer of a very complicated problem. But there's a lot of truth to that. But I could say, okay, I want to lose weight. Is that a good goal? Yes, that's a good goal, because that's going to help you along the road to reversing diabetes. In fact, it's essential for diabetes. Is it a SMART goal? No, because a SMART goal has to have 5 characteristics. It's specific. Is that a specific goal? How much weight are you going to lose? Well, I haven't decided. Well, then how are you going to know you got there? So we want a specific goal, so it has to be something that we can measure. So if I said I want to lose 5 pounds, my goal is to lose 5 pounds. Is that a good goal?
Yes.
Is it a SMART goal?
Yes, it is.
Maybe. Maybe. No, it's not a SMART goal. It is measurable. Is it attainable? Depends. If you say, I'm going to lose 5 pounds by this time tomorrow, no, that probably won't happen. Anyway, it needs to be attainable, it needs to be relevant, it needs to be time-based. So if I say, I'm going to lose 5 pounds, today is the 16th, of September, so by the 16th of October, I'm going to lose 5 pounds. Is that a SMART goal? Yes, because it meets all of these characteristics that you're seeing up here. It's specific, it's measurable, it's attainable, it's relevant to our problem, or R could also stand for realistic, and it's time-based. It meets all of those criteria. So that's one of the first places we need to start. And in this program, every night before you go home, I would like to see that you fill out a new SMART goal sheet for the following week, except the very last week, and then we're going to fill out one for the next 3 months. Okay? And there are 8 areas that we want to concentrate on, and that's one of them. Fiber. Fiber is the place we've got to start. If you're going to reverse your type 2 diabetes, you have to eat more fiber. Diabetes is caused in part because of a fiber deficiency in the diet. And that fiber deficiency does a number of things. One of the things that fiber does is in the intestine, it makes a gel, and it slows the absorption of sugar. And so, you can eat a lot of carbohydrates if you're eating a lot of fiber, and it's not going to drive your blood sugar up. But there's another thing about fiber that's extremely important, and you may not know this. Fiber feeds bacteria that live in your gut. And we're going to talk more about that later on, but those bacteria that live in your gut, if you feed them certain foods, certain strains will grow. It's like they're really picky eaters. And so it just so happens the standard American diet makes bacteria grow in your gut that increases insulin resistance. It makes your diabetes worse. So if you're eating the standard American diet, the fried foods, the marbled meats, the processed meats, things like that, you're going to be in trouble because you're fighting against yourself. What you need to do is you need to increase the fiber in your diet. There's only one place in our diet that we can get fiber, and that's plants. There's no plant. There's no fiber to speak of in our meat supply. There's none in milk. There's none in cheese. There's none in eggs. Those foods just don't have it. So you've got to eat more plants because we need to get the fiber. Now that's why we had the breakfast bowls that we had today. Those nuts and seeds, they're high in fiber. Even the pineapple, the berries that you had, the grapes, every single plant has its own, you might call it fiber fingerprint. And the experts tell us that if you're going to reverse disease, you need to eat at least 30 varieties of plants in the course of a week. So you can't eat the same thing every day. It needs to be 30 different varieties. That will give you a fiber blend that is going to set you up for big-time success, okay? Because it's going to cause the good bacteria to grow that you need to grow to decrease insulin resistance and help drive your diabetes in reverse. So get to eating. You need to eat more. Start right where you are, but add more fiber. How much? Well, if you add all the fiber that you need for a reversal diet, by this time tomorrow, if you made that change tonight, dinner time tonight, by this time tomorrow, you won't like me, and you'll probably drop out of the program because you'll be bloated, you'll have gas, you won't feel good. And so anyway, what you want to do is start out measuring the amount of fiber in the food. So, it's easy to do. We live in an age where we have a smartphone. You all have smartphones? You have Siri activated? Hey, Siri. How much fiber in one serving of asparagus?
Half a cup of asparagus contains 1.8 grams of fiber, which is 7% of daily needs.
Don't believe the 7% of daily need. Don't believe that part. But 1.8 gram, half a cup of asparagus, not too bad. Hey Siri, how much fiber in half a cup of pinto beans? 7 grams of fiber, half a cup of pinto beans. Beans happen to be the king of fiber. I mean, that's really a great place to go. So utilize your smartphone. And you say you're eating out. Hey, Siri, how much fiber in a burrito supreme from Taco Bell? Oh, let's see. That one didn't turn out too well. Hey Siri, how much fiber in a Big Mac?
Okay, I found this on the web for how much fiber in a Big Mac. Check it out.
It's going to make me hunt for it here. So anyway, but you can go to your... No, because a Big Mac usually has a little lettuce and tomato, doesn't it? The lettuce and tomato, and the bread will have 1 gram of fiber. So you'll be about 1.2 grams, I think it is 1.2 grams of fiber, or maybe just about that. So it's a low in fiber meal. So we need to increase the fiber content in our meals so you're eating 20 to 25 grams a day. Now next week we'll increase it to 30 to 35, and the next week we'll go 40 to 45, and the rest, the week following, will be 50 grams or more, and you stay there for the rest of your life. And if you do that, you'll probably be like me and Karen. We both had prediabetes, and I lost 35 pounds, and she lost something she's going to tell you about later, which was significantly more than mine. And anyway, but we have gone now for almost 13 years, and neither of us have a smidgen bit of diabetes. Her A1C, I think, was 5.2 last check. Mine was 5.3. So that's the first time she's been lower than me. So I've got some work to do, right? Anyway. Okay, so get to eating more fiber. Some people will come to me and they say, well, I just can't eat this much. Well, that may be true, but make sure you eat your fiber foods first, okay? So we're going to focus on getting the fiber up so we can get the insulin resistance down, and your diabetes will go away if you're doing that. Okay, next thing is water. You need to drink 8 to 10 glasses of water. This is especially important for people that are increasing the fiber in their diet. Some people will get very constipated when they do that. The majority of the population will have the opposite problem. You know, your stools will become a little softer and it'll be easier to go, you know, you'll be more regular. But there are a few people that do get constipated. And if you happen to be one of them, you need to know it's probably because you're not drinking enough water. So increase the amount of water you're drinking, first of all, to make sure that that happens. Or that doesn't happen to you, rather. And if you do experience difficulty, then maybe take an over-the-counter laxative or talk with your doctor, you know, to get him to prescribe you something big. But most people will not experience that problem. But if you experience it, just drink more water. And drinking more water also has the benefit of helping flush out extra sugars, and so your blood sugar will be less as well. Thirst is often mistaken for hunger. So if you are hungry, the first thing I want you to do is reach for a glass and drink a glass of water before you go eat. And you'll probably eat less. People who drink more eat less. So, then diet. We want to focus on high nutrient foods. Now we're going to have a whole lot more to say about that further on down the road. An easy rule of thumb, since you're trying to get lots of fiber in the diet, just try to eat every color of the rainbow every day. So just think, have I had my pinks? Have I had my blues? Have I had the reds, the yellows, or the oranges? You know, so things, you know, the colorful vegetables, butternut squash or peppers or melons or carrots or zucchinis or cucumbers or whatever it may be. And you cannot out-exercise a bad diet. You have to you need to focus more on the foods that are lower in calories, because the object of the program will be that hopefully you lose some weight as you go through. The average person usually loses between 5 and 8 pounds as we go through the program. I have seen people lose up to 14 pounds in a week. We don't recommend that you lose it that fast. It's not healthy to lose it that fast. But some very large individuals, you know, 300, 400 pound person, sometimes when they start the program, that will happen. They'll be able to lose quite a few. And it's okay, but you don't want to continue that over the long term. So you can double the nutrient content of your food simply by doing one little thing, and that's eat one serving of something fresh with every meal. So if you're having a lunch meal, have a salad to go along with whatever your food is. At breakfast, eat a piece of fruit or some berries or something like that. And your dinner meal, again, you know, something fresh with each meal. So we want to replace the toxic foods with healing foods. We'll learn more about that as we go along. Recipes. Ladies, don't despair. Or men, if you're doing the cooking too. The average person at home cooks 10 different entrees, 10 different meals. Now, they may make little variations, and instead of serving broccoli, they might serve peas, but typically the average person makes only 10 meals. So if you look at your entrees and you have all standard American diet kind of entrees, and you think, well, I can do better than this, then look for higher nutrient foods to replace that with. But understand, this is not a desperate situation. You just have to learn 10 new recipes, and you have it made, right? So try new recipes, and you'll have some successes. And if you're like us, you'll have some failures. And I can't count the number of burnt offerings and whatever else. Or we have had recipes that were so bad, seriously, the dogs wouldn't eat it. Karen tried to make some pumpkin pies that were high in fiber and whatever else, and it was just like disaster. And we had company there for Thanksgiving. And she brings this out and puts it on the table, and we took one bite, and it's just like, wow, this is awful. And so we said, well, let's feed it to the dogs. No. Dog turned his nose up and walked the other way. And he would eat anything, but he wouldn't eat that. So you'll have some of those. Be prepared to understand that. And maybe you don't like some of these foods. Let me encourage you. Your tastes will change. Your tastes will change as you start eating the things that mentally you know you need to do. Then you will begin liking them. In the meantime, you might say a few bad words about me, but that's okay. It does happen, and almost every class I hear someone say, and it did. You know, it did happen just like what you said. So be sure to share your successes, but also your failures. You know, we are a whole group, and we're struggling with the same thing. Karen and I happen to have been down the road. Some of you here have been down the road, have already attended one of our classes, and you know sort of what to expect. But you know that there's going to be, sometimes we come in and you just bombed out. It didn't go well, and you fell off the bandwagon, and you binged on whatever. We understand that, but we can help. We can discuss it together. So let's share all those successes and failures, and we're going to plan overall for success. And then exercise. Whoops, I went too far on my screen. Your screen's fine. Moderate exercise. There's 3 kinds of exercise that'll be very important for you, and we'll talk more about it as we get into it. The most important form of exercise is walking immediately following the meal. We're going to talk more about that next week, so I'm not going to say much more about that. If you can't walk, move something. But walking uses the big muscle groups. Avoid periods of inactivity of greater than 30 minutes. So if you have a desk job and you sit for long periods of time, basically set a timer. And every 30 minutes, you get up, walk around the desk, you go to the bathroom, you carry an email across the office, or you do something, You get up and move about every 30 minutes. A prolonged sedentary activity will stand in the way oftentimes of being able to reverse your diabetes. Weight training. All of us are adults, it looks like, and adults, when they get to 35, start losing, on average, about half a pound of muscle mass a year. And you can prevent that. By the time you get to 70 years of age, you're losing a pound a year. And then you get older still, and you'll lose, 80-year-old will be losing about 2 pounds a year. So doing some weightlifting twice or 3 times a week can prevent you from losing muscle mass. Muscle mass burns a lot more energy than fat mass. Okay? And that's one of the reasons why we want to hold on to our muscle mass. And then burst training, we'll learn about in just a little bit. But you need to do it 3 to 6 times a week. You start out like every other day, 3 times a week. And that's basically equivalent to taking a metformin tablet in a month of doing that. It would be like taking a metformin tablet once a day. So need to be sure that you avoid eating just before or right after doing your burst training. So burst training needs to come in between the meals. Okay? 3 forms of exercise. And then the next one is sleep. People that get less than 6 hours of sleep a night typically have a very difficult time reversing. The optimal seems to be 7 to 8 hours. If you're getting more than 8 hours a night, it doesn't give you additional benefit. But 7 to 8 hours is optimal. You need to set a regular time for sleep. Turn off all electronics about an hour before you go to bed. So no more blue. Turn off your phone. You don't need to watch those messages anyway, because it'll make you think things you don't want to think while you're laying in the bed. And you need to darken the room. I know so many people in the hospital, they go to sleep with the television on. I guess it's their white noise or whatever. But it inhibits the secretion of melatonin. And melatonin is very important for restful sleep. So you need to sleep in as dark a room as possible. If you like light up at night, well, just put a flashlight by the side of the bed. Okay? Weight. It's imperative that a person loses weight. If you have prediabetes and you lose just 2 pounds, you decrease your risk of diabetes by 11 to 12%. If you lose 10 pounds as a prediabetic, you've just decreased your risk of diabetes by 60% unless you're over 65 years of age, in which case it's 70%. The average person with diabetes has to lose about 17% of their body weight from the time that they were diagnosed with diabetes. So if you weighed 200 pounds when you were diagnosed with diabetes, for instance, then you would need to lose, on average, probably 34 pounds in order to reverse your diabetes. And by the way, science, they've done a number of studies on this right now, and science is pretty sound. If a person loses 33 or more pounds, about 84 or 86% of them will reverse their diabetes. That's with just 33 pounds. So it's good news for us. Now, next week, we will be talking about how to lose weight, make it easier, how to make it easier to lose weight. Blood sugar safety. A lot of people, they simply don't, they've gotten the diagnosis of diabetes. They're discouraged. I understand that. And they don't like sticking their fingers multiple times a day. And they figure, well, I'm going to have this the rest of my life. I'm just going to do what makes me feel good. And they don't check their blood sugars. When you're going through a reversal program, I don't think that's a good idea. So please, check your sugars. If you feel shaky, check your sugars. I know so many people in the hospital. You can bet your bottom dollar almost. They turn on the call light and say, I'm feeling shaky. I need some orange juice and crackers. Or I need something to eat. Can you bring me some hard candies? And the first thing I do is I go grab the glucometer and I'll walk down to their room and I'll check their blood sugar. More than 90% of the time, that blood sugar is going to be something like 250, 340, or something like that. It's going to be really elevated. You don't need orange juice with a blood sugar of 340. We need to get the blood sugar down. Why are you feeling shaky? Well, there could be a whole array of reasons why you feel shaky. But this is not something that you need to do. So our goal is to help you reverse the diabetes. So test, test, test. So if you feel shaky, you test. High blood sugar gives you some warning symptoms. Usually you feel a little foggy in the head, and you might have blurred vision, things like that. Low blood sugar, I've gone to rooms of people that, they're passed out cold, or they come into the ER, they're just, we check a sugar and it's 17 or something like that. And the doctor is standing at the bedside, hurry up, let's get a line. He understands the seriousness of what we're dealing with, and we got to get some sugar in the body to counteract whatever's going on there that caused their blood sugar to be so low. And 5 minutes later, the person's sitting up in bed and talking to you. We inject some intravenous glucose. Anyway. Test often. Test is directed by your doctor. When you feel shaky, test before you snack. Okay? And so blood sugar safety. And then according to the Centers for Disease Control in Atlanta, the very best thing that you can do to treat your diabetes is what we call diabetes self-management education. That's what we're doing here. You learn the things that you can do at home that will make the blood sugar come back under control. The second most important thing is called diabetes self-management support. And that's where you get together in a group with other people of like, problems, and together you discuss what you can do. You discuss the issues. You talk about interventions. You talk about problems and possible solutions. And then the third thing they say is medication management, medical treatment. So unfortunately for the doctor, medical treatment is number 3. Unfortunately for you, it's usually the number 1 intervention. So these other 2 will be, in the long run, the best thing to do. Remember that only you can reverse your diabetes. Your doctor can give you instructions, but our medical director, when we wrote the program, was Dr. John McEwen, and we were telling people at that time it's 10% doctor and 90% you. And he sat there in the lecture and he shook his head and he just spoke up and he said, no, that's not true. He said, it's 5% doctor and 95% patient. So, you're the one that makes the decisions that will help you control. So I've given you an overview here of the various things that you can do. Your doctor can only treat your symptoms. And he can advise you to lose weight. Or he can tell you to eat less fat. And he can also tell you to get more exercise. But the choice ultimately is up to you. So, Jeff, buddy, come on up here. I want you to meet Jeff. Jeff is a good friend of mine, and Jeff likes to exercise. He's happy to exercise, and he's going to demonstrate to you guys what burst training is.
You guys ready?
We are ready.
All right, if your doctor has given you limitations, we understand. So, if you start developing chest pain or something like that, sit back down and just be still. You know the things to do. If your doctor's told you to don't exercise, we understand. But all the rest of you stand up.
So, Mike, you're off the hook. Steve, I thought that you had asked Mike to do, so we were talking about it earlier, and he's going,
Well, Jeff